Well, we have some video of you working on a horse, so we can give our viewers an idea of what it means when you are adjusting and palpating. So let's watch that video, and you can walk us through what it is that we're seeing you do here.
Okay, right here is, and basically I like to start just saying hello to the horses. You see her ears are kind of back a little bit. She's not sure. She's just 2 years old. And I'm up here working on her temporomandibular joint, or TMJ.
Okay.
I'm kind of using a release technique, a myofascial release technique on that jaw, so that I can, that's an area of common, whether they've had a bit in their mouth. I've seen this in day-old foals where they'll have a little temporomandibular joint luxation there. And this, in people that have that disease, complain that it's painful. And I think true for horses, if they have a little bit of a malalignment of that temporomandibular joint, it can cause them maybe to have pain while eating, and just maybe not be quite as happy.
And that can translate all the way through their whole body, so that's why you start right there,
yes,
correct?
And what we've recently learned in the last couple of years through all of the good research is that temporomandibular joint is actually a disc joint. It's a small joint that has a little disc inside.
Okay.
So again, another area of pain if there's malalignment or compression on that disc. Here I'm just going over the whole neck, and I'm evaluating. This horse is not tranquilized and has no medication, but they allow me to just move one bone at a time. And here I'm going over the first cervical vertebrae right there, and she has a bit of a compression because it's taken me a little bit to release it. And then you can see as soon as her head would move, I've actually released. I work under this a nuchal ligament, which is the ligament that is at the pole and attached and goes all the way through the cervical or neck vertebrae down into the top of the thoracic vertebrae, or on the front slope of the wither. And the nerves that are innervating our front limbs are basically coming out of the first 3 cervical vertebrae, cervical 1, 2, and 3. And we know that there's cervical 4, 5, 6, and 7. The ventral branches are actually also going to the hind legs. So by understanding that part of the neuroanatomy, we can see that problems in the neck can actually cause lameness problems in behind. And there's a condition that's well known called wobbler syndrome, which is born with stenosis or closure of the facet where the nerve comes out of the cervical vertebrae, and C5 and C6, and that will cause the horse to have wobbles. They call it wobbles because it'll be weak and they won't know where their legs are. Right here, I'm using a combination of acupressure there, and I was adjusting the first rib, or the costochondral junction. And I'll just go back and forth. It takes me, depending on what the horse is doing or how much compression they have, it'll take me a little bit of time. And here, right there, I'm going over some of the thoracic vertebrae there, and you can see every time she'll pinch down is when I'm adjusting. You'll see her dip down, and then her ears are, she'll go up. She's very comfortable. We have no restraint, no restraint at all. They because there's an immediate relief.
Okay, so you can tell she's not trying to get away, and sometimes leaning back into you even.
Yeah, exactly. And there, I'm checking her sternum. There's problems that can come from the sternum, and right there, I check the sternum and the wither at the same time, because here, when we have riders and tack and a girth, we can, maybe not create a problem, but we can make a problem worse. Okay. And so I check all. Now, one of the things that I've taken advantage of is that these horses have tails, so I'm able to facilitate my sacral and lumbar and pelvic adjustments by using a tail rope.
Okay, I think that'll come on later in this video. Go ahead with that.
Well, basically what this allows me to do, and I learned this, is to sort of open up those spines through a little gentle traction, so that it makes it easier for me to manipulate and to release the problems. And I use a long lever move in the hind limbs to actually facilitate a sacral iliac adjustment in the sacrum.
Okay, and so explain adjustment or manipulation and what you're kind of accomplishing there.
Well, what we are and what horses are when they're born, basically they stand within minutes, and sometimes they fall down, and sometimes they just fall down a few times and running around as they do day one. And so the structure of the spine is really not organized. It's basically Dr. Still, who in 1867 developed the human osteopathic techniques. His favorite term was, we're just a wobbly string of bones.
Yeah.
And so when people ask, well, Doc, how did that happen? I've not even ridden the horse, because oftentimes my clients will will want me to go over the horses as soon as they buy them, before they've even set foot on a track or put the tack on. They want to just make sure they're right, in prevention of.
Okay, very smart thing to do.
Many of these things have come up even just as they developed, before they even got to the farm, through their weanling and yearling stages. This is the show horse that he's a jumper that I'm working on here. And again, same technique, starting with the neck. Always feel that if I can, make them happy in the jaw and the neck, they understand that I'm going to help them.
Yeah.
And I rarely get a complaint. In fact, sometimes the people will say, Doc, don't get near this horse, he's terribly mean. And those are the horses that come right to me and, just like, fix it now.
So what are some signs that a horse is feeling that relief and release?
Well, basically their ears, their head might, even when you're acupuncturing there, their head will just drop, 6 to 8 inches, while they'll start to kind of move their lips in a slow fashion, maybe even let out an audible sigh.
Okay.
They tell you. They can't talk, but they tell you.
Okay.
And there's an elbow move right there. I use a combination of acupressure on the elbow points from the acupuncture and a myofascial release. And elbow pathology is, it's not uncommon. This is what we say in veterinary school. That means it happens. It's not as common as maybe a neck or a shoulder, or a sacrum problem, but it can happen. And, it's something that can cause a lameness. And if there is a malalignment of the elbow, it will put pressure on the foot, if that makes any sense, because they basically, they have a short stride and they almost stub their toe. So if that's not picked up, you can create a foot problem.
And so after you work on a horse and you adjust, how do you make sure that the horse doesn't fall back into the way he was?
And that's kind of a great question, because as I've evolved over the 23 years, I was always looking for ways to lose the muscle memory. How can I see them less? And I use a combination of, I can use therapeutic drugs like muscle relaxers. If there's a significant spasm that I feel that would be beneficial, I will give them an intravenous injection of methocarbamol or Robaxin.
Okay.
If the horse has been very lame for almost a year, I might even put them on a 3-week course of another primary muscle relaxer called Dantrium. That's an oral product. But for the most part, I just employ use of acupuncture, which will reduce the muscle memory. It'll open up channels that go to the body part, and sort of the body always wants to be normal.
Right.
And we know, like, if our shoulder hurts and maybe a little while our neck might be bugging us, and similar to the horses. And the body will set up blocks within itself so that we don't feel the pain.
Okay.
That's God's given nature, that, we don't want to be painful.
Yeah.
So the acupuncture will actually open up some of these channels and allow blood supply. There's no healing if we don't have blood supply.
Okay.
And it will cause muscle relaxation. So there's not the tension to pull it back into its malaligned position, but rather its normal